Welcome everyone. Thank you for joining us this evening. Nice to see a lot of new faces, and some familiar faces have joined us here tonight. Thank you very much for everyone for coming. And our topic this evening is chiropractic neurology and concussion management, and we have a special guest speaker, Dr. James Haxton, will be joining us. But first, I'd like to introduce myself. My name is Deb Angus. I'm the founder of this group. We started in November 2016, and I'm a traumatic brain injury survivor warrior since 2001 as a result of multiple concussions throughout my lifetime. And I was diagnosed via neuropsych assessment at the Foothills Hospital as mild, borderline moderate TBI. And my cohort here is Josie, and she is a former healthcare nurse, and she is 3 years post-injury and still learning to live well in spite of her brain injury. And the reason we started up this group was to raise awareness about the seriousness of concussions and traumatic brain injuries, to help you understand the symptoms of a concussion, how easily these injuries happen, the healing process for concussions, and consequences of multiple concussions, to share coping strategies that will help you while recovering from a concussion, and to live well in spite of brain injury, to provide support for those afflicted with these injuries, and to also help family and friends better understand what you are truly up against with this injury. We have medical disclaimer here. The ideas, suggestions, and general principles and conclusions presented are subject to your personal health and sound medical advice. Every possibility is not represented here, nor do we presume that all possibilities relate to your specific situation. This awareness group is not a substitute for recognized medical advice or treatment. Always consult your healthcare practitioner for medical advice. We have group guidelines here with confidentiality, respect, and participation. Thoughts, feelings, and experiences shared in this group will stay in this group. Respect others' right to keep their information private. Accept and respect what is unique to each attendee in the group. Be respectful of others' spirituality, religion, and belief systems, and allow others equal time for sharing. This is when we get into the sharing circle at the end of the meeting. Participation, feel free to ask questions at any time, during the presentation. If you prefer to remain silent and pass on sharing at any time, please feel free to do so. And our general meeting structure is 20 minutes presentation. We'll try and fit in a 10-minute break if anybody needs it, but then we continue on with Q&A with our guest speaker, and then we follow at the end of the meeting with the sharing circle. And this would be a good time for everybody to turn their cell phones off. And now we get into this evening's presentation, Chiropractic Neurology and Concussion Management, with our guest speaker, Dr. James Haxton. And I have some intro here for him as well, too. He is a doctor of chiropractic, graduated from Life West Chiropractic College in California. He's also a diplomate of the American Chiropractic Neurology Board, and he received additional 3 years of training in advanced neurology from the Carrick Brain Institute in California, which earned him the DACNB certification. He currently owns and operates Heritage Point Chiropractic and Massage, which is located at the south end of Calgary city limits near Dunbow Road. And Carrick Brain Institute, a little bit about that. The Carrick Brain Institute was founded in Cape Canaveral, Florida in 1979 by Frederick Robert Ted Carrick. Since then, the Institute has trained more than 14,000 physicians, including chiropractors from all over the world. Dr. Carrick is a Canadian-born chiropractor who, over the span of his career, has developed specialized concussion treatments. He is also the doctor responsible for helping Sidney Crosby get back on the ice. And we did post a couple articles about him on our event posting for this evening on Facebook. And if you're not on Facebook, I don't have copies of these for the sake of paper. But you can just Google for that Canadian chiropractor and brain practice, and Google Maclean's magazine, Rebuilding Sidney Crosby's Brain, if you want to have access to those articles. Chiropractic neurology, also referred to as functional neurology, or FN. Focuses on the assessment and treatment of brain disorders without the use of pharmaceuticals or surgery. It works to improve the function of the nervous system and the effect this has on our health. Treatment protocols involve the use of a variety of technologies for diagnostic and measurement, vestibular therapies, and eye exercises aimed at stimulating the brain to address dysfunction, as well as some chiropractic work. Positive outcomes. This is some comments I've heard from people over the years. FN has given me my life back. Yes, we have heard wonderful things about FN, and are actually heading down to the clinic in Georgia next week to begin treatments. That was a couple that showed up here a few years ago, and I don't know, they've never followed up with me, so I never heard back how that went with them. So if they are here tonight, or if they're watching the videos, they can get in touch with me and let me know how things worked out for them. I appreciate that. And also, so glad to hear there are now FNs here in Canada. There is no way I could ever afford to go to the States for treatment. Now this is a disclaimer as well. I'm not putting it in to put off anybody, but this is general. In any modalities or any therapies, I want to bring your attention to this. As with any therapy or healing modality, not every intervention has the same results for everyone. So you do have to be aware of that possibility and reality. You should do your own due diligence. Do as much research as you can on that particular modality. Speak to those who have had that therapy to get their experience with that. And be sure to check with your insurance provider before beginning any treatment program to ensure it will be covered or be willing to pay out of pocket. Ensure the practitioner you're seeing asks for a thorough history and background on your particular injury or injuries. This is like if you go see a massage therapist, craniosacral, anybody, you should be asking all these questions. How did your injury happen? How long ago? And any prior injuries throughout your lifetime. Very important to be aware of your own concussion history, such as I was not in 2001. Your age and any possible lifestyle choices that could affect the outcome of your treatments. Are they forthright in advising if that therapy can help you or not? Very important. Some practitioners are very forthright and very forward and say, well, we can try it, but I'm not holding out any guarantees that this will do anything for you. Ensure you receive a summary and presentation of their diagnostic findings. And ensure you know what the treatment plan will be on the onset. And as well too, they do have the American Chiropractic Neurology Board. They do have a doctor locator utility. So here you can go in and put in the city or the state or province or even a different country, and you can find who are listed in there. Make sure though they have the DACNB designation. As well too, you can just go in and put in your postal code and say, 40-mile range from that postal code, and you can find some doctors that way as well too. So without further ado, Dr. James Haxton.
Okay, how's everyone doing?
Pretty good so far.
That was a great introduction to have you actually, you saved me a lot of time explaining some of that stuff, so thank you. Welcome. So basically, I'm really excited to talk about concussions because there's so many myths out there. I want to clear up a lot of that. There's so much misinformation out there too. So I just want to give you some general education, and you can take home a lot of this stuff tonight and start applying it right away, no matter what your situation is really. I'm going to cover a ton of material. Let me know if I'm talking too fast. I can definitely slow down. I'll probably go over the 20 minutes here that you gave me, but just by a few minutes. Can everyone hear me okay? All right, so let's get going here. Now, has anyone seen this before? No. So this is a team of UCLA researchers that crafted a model of the brain, and they actually figured out how soft it really is. It's more like Jell-O. A lot of people think the brain's very firm, but when you hold it in the hands, it jiggles around quite a bit. You can see they're not actually hitting the front part of the skull there very hard, and look how much it's moving. Obviously there's more fluids inside and some more ligaments and other supporting structures, but just want to give you an idea of what we're dealing with here. And we're going to go over in just a little bit here what's actually happening in the brain when that happens. So just a little bit of a roadmap here. I'm going to introduce the topic. We're going to go over a definition of concussion. Deb and I were actually talking beforehand. Maybe I should explain that.
We all know that here, but I wanted to make sure he was aware of how we are with concussion versus mild traumatic brain injury.
Yeah, so there's a lot of terms that people use to describe a brain injury, and so I'm going to be using concussion tonight, but just be aware there are some other terms that don't really mean the same thing as well, but I'm going to keep saying concussion. So So we're going to talk about basically what happens during a concussion when the brain's rattling around. We're going to talk about the current research out there. I'm not going to bore you with facts and figures and case studies and all that, but I'm going to summarize a bunch of the most current research on a few slides as well. I'm going to go over the signs and symptoms, basically what a concussion looks like right after the fact, as well as a few days, few weeks, months, years down the road, and some things that you can actually do right after it happens as well. So I'm going to go over our approach. It's a little bit different with handling concussions at the office too. And just a few tips and tricks to prevent concussion. All right. And like Deb said, we're going to have some time for some questions at the end as well. So there's a ton of stats and figures here, but just know that concussions are a huge issue. And whenever you see any concussion stats, just know, as this line says right here, that around almost half go unreported. So any figures that you see are probably double or even more. So it's a huge issue. One thing I want you to draw attention to is this last line here, and this is what makes concussion so difficult to diagnose and treat. Is it's a very complicated situation that's happening inside the brain, and so it takes people with a lot of experience and training to actually recognize the different signs with concussions and appropriate treatments for those as well. And it's very easy to do too much with concussions, and people tend to try to do the same thing with each person that comes in, which isn't really the case. It's not going to get the best results with that. Now, sports get all the spotlight and the fame, but it's still car accidents that are actually in this age group anyways. I couldn't find any more stats on that. 15 to 24 years old, it's still car accidents that are a major cause compared to sports. And then on to the topic of sports. Hockey, yes, in the males, that's a biggie for sure. I almost have entire hockey teams coming to see me at certain times. It's increasing for a few reasons. It's one, we're getting better at recognizing concussions, and people are getting more competitive as they're playing. Athletes are getting bigger, faster, stronger as well. So the females, this might be a bit surprising. Soccer is definitely up there. Females are a little bit different biomechanically, and so their style of play and soccer itself sets things up to be a perfect match for concussions, unfortunately. So we see a lot of soccer players as well. So in the last 10 years, seen a 40% increase in football, soccer, and hockey concussions, and that's probably, once again, a very low stat. It's probably a lot more than that too. And then Stats Canada had this one in the bottom here, that in the last year or so, adolescents reported, 23% of adolescents have reported a head injury within the last year or so. Once again, that figure is probably low.
And it's interesting, falls and horse accidents aren't on there.
Exactly.
Yeah.
It's tough to find stats on concussion. Canada's pretty sparse compared to the US. I've included a ton of US stats in the past, and it's tough. Just know that it's a huge, huge issue. So everyone always thinks that every time that you hit your head that you're going to get a concussion, which isn't the case. And about 70% of the time it's going to resolve in about 10 days or 2 weeks or so. And the other 30%, that's where issues arise. And these are the chronic cases that don't respond to just normal healing and other conventional therapies too. So these turn into the tough cases. So this is surprising too. A lot of people think that kids can actually heal from a concussion faster, but it's totally the opposite. And this is what we see in our office as well. Kids can heal broken bones faster. They can recover from being sick faster compared to adults. But with concussions, it takes way longer. And it's because their immune system is actually a lot more immature, and so it overreacts to the head injury, and it creates more of an issue after the fact. So all the experts on concussion in the world get together, and they have conferences every now and then about how to best manage this stuff. And the last one was in 2016, and this is the definition of concussion that they came up with. So you can see there's quite a few points actually. It's not just an impact to the head causing headaches and light sensitivity. There's actually a lot to it. So we'll go over a few because they're actually pretty important. So a blow to the head or elsewhere on the body. So you don't have to hit your head to get a concussion. That's a major point. It can be a quick blow to the chest. It can be a quick blow to the shoulder that jolts the torso, that sends a lot of the impact, the force up to the brain. So I've had a lot of people say, you know what, I fell down the stairs, but I didn't hit my head. Or I was in a whiplash car accident, but my head didn't hit anything. And so it still doesn't mean you're out of the woods. Okay, and a rapid change in neurological function. And this is, once again, why concussions are so difficult to manage, is it can look one way a few days after, it can look another way a few weeks down the road, it can look totally different a year down the road. And this is the issue, say you got into a bad car accident and you felt okay and you think you're doing fine a few days after, and then 2 weeks down the road you just totally crash again. Not the car, just yourself. And so it can really be evolving is what I'm going after there. So the symptoms are caused by functional changes, not structural damage. And this is a biggie here. So people that have a concussion, they go to the hospital, they get their MRIs, their CT scans, X-rays, all that stuff. All the tests are normal, and they send them home and they say, oh, rest for a few days. And that's kind of what we have right now. So concussions are a functional issue. Basically, what talks to what in the brain isn't really working the best. And all these different networks aren't really talking to each other effectively. And this is where we come into play. We do a functional neurological analysis. So this is right up our alley, actually, to evaluate this stuff as well. Okay, and the last point here is it may or may not involve you losing consciousness. So it doesn't tell you how bad a concussion is if someone blacked out or anything like that. I've had some concussions where some patients come in, they blacked out for, I think there was 5 minutes on the field. They did better than some people that haven't blacked out. So you can't really take that to the bank as well. Okay, so we're going to go over basically what happens when the brain is shaking back and forth when you are in an accident or you're playing sports or anything like that. So the head's going to move back and forth, and unfortunately the brain follows and it actually rebounds forward and backwards. And this is called a coup contra coup injury. So as the head goes forward and then snaps back quick, the brain rebounds on the front of the skull and then rebounds on the back of the skull. Hello, come on in. And then unfortunately it doesn't stop there. There's some rotational force involved too. And we'll talk about this in a little bit here. So the brain is perfectly suited to getting a concussion just the way that it's actually designed. And it's wider in the top and then skinnier near the bottom. And so because of this design, it literally can rotate and twist quite easily. And this causes shearing forces. So picture the brain is wider in the top, skinnier in the bottom, and then it's placed on, I have the straw as a neck in this example, but the neck is a relatively flexible, skinny structure that the brain is trying, and the head is trying to balance on.
I say that quite often here. We have a major design flaw.
Yeah, exactly. Yeah. So unfortunately, we weren't built perfect in some aspects. Okay, so we have this rotational force. You can see just from what these nerves are doing, they're starting to twist and break. And it's called a shear force there. So I have a blue towel, and hopefully this will be clear for you. So picture this is one of the nerves in the brain, or even a part of a region of the brain. Let's say you have something delicate in the middle, so like an egg or something like that. I didn't bring an egg, but it'd be too messy. So you have the egg in the center there. As the brain shakes forward and backwards, it also twists. And just picture what's happening with the egg on the inside there. So that egg that's deep inside the brain there controls your heart rate control, your digestion, your pupil reflexes, a lot of stuff that's not under our control. So that's why a lot of concussions have a widespread presentation with symptoms. Kind of clear? Okay. So unfortunately it doesn't stop there. So we're going to recap all the forces with the concussion here. So you've got the forward back movement, you've got the twisting, and then you have the swelling. So number 4 there. It's sort of like if you sprain your ankle, you get swelling. Same thing in the brain too. And this is what can prolong some symptoms after the fact as well. So we're going to talk about some current research here. And so I'm just going to, like I said, I put a ton of information from a ton of research papers on just a few slides here. And you're going to notice a theme that what I'm going to talk about, there's a lot of effects with the eyes with concussion. So the eyes have a huge part in what's going on. And so let's go over a few of these. So people with concussion can't actually pursue something very well. So it's as if you're staring at something and it's moving by you very slowly. So you can't do this voluntarily, you have to look at something moving by you. And that's tough for people with concussions. Saccades are slower after a concussion, as well as they take longer to happen. So these are your quick eye movements. If you're just looking around the room right now, you're doing that eye movement. So they're slower afterwards. They aren't as accurate as well, so you say you move your eyes from one side of the room to the other, they actually miss a little bit and they have to come back after a concussion. So we measure a lot of that stuff there. And then this OPK reflex is thrown off too. And that's as if you're watching a train go by, you're looking at one car and the next one and the next one. And that's basically what the eyes do during that reflex. So you can test that when you have someone close their eyes. We'll explain this in a little bit. And when we're moving their head back and forth, that's literally what the eyes are doing. They should move back and forth like that, but they don't do that very well. They kind of get lazy after a concussion. And there's a few other eye movements as well, but just know the eyes are greatly affected. They say that the eyes are the window to the soul, and they're actually the window to your nerve system as well. So you can actually see a lot about somebody just looking at their eyes.
Sorry, does the same go for computer screens and even screens like this tonight? Just looking at anything?
Yeah, exactly. Yep.
TV screens?
Yeah, so that's kind of falls in the other eye movements category. When you're looking at a computer screen kind of even right in front of you, your eyes should come together and they should get closer, and that doesn't work very well after a concussion, so that's why people struggle with that there. So you have to do a lot of therapy of looking at something far away and then close up and just basically bring it back and forth slowly so that the eyes can kind of retrain with that. Yeah, and same with the pupils. So when you look at something close up, the pupils should actually get smaller, and that doesn't work very well afterwards too. That's a good question. So people can't actually do two things at once very well. Maybe some of us were poor with this before concussion and just made it worse. So this is impaired dual tasking here. And we test a lot of this here. So multitasking is off. Same with walk speed. People literally walk a little bit slower after a concussion from one point to another. Center of gravity and balance are worse, and coordination as well. And this is a little bit of a different part in the brain here, but just know that everything's connected in your brain to everything else. So if you have a change in one area, that changes other areas too. So they actually found with Alzheimer's disease, someone that was actually diagnosed with that, 3 to 5 years before they were diagnosed, they actually found huge changes in their balance. And so a change in one area can cause changes in other areas too. Autonomic regulations, that's basically your automatic movements that we were talking about. So your digestion, your heart rate, pupil control, that's all thrown off after a concussion. Reaction times, and this is all frontal lobe stuff that I'm talking about here with multitasking, with your reaction times, with your personality as well. So the eyes, the frontal lobe, you're kind of seeing some themes here that can change with concussions. Okay, are you going to chat about the vagus nerve a little bit with them after?
No, I actually have the session plan coming up
Okay.
in the future. I'll do a whole meeting on that.
Okay, sounds good.
But I'm glad you're covering that.
Okay.
today.
Has anyone heard of this nerve before? Alrighty. So it's not the Las Vegas nerve, it's the vagus. V-A-G-U-S. So that stands for wandering nerve. It goes kind of everywhere. It goes to your lungs, your eyes, your heart, your digestive system, the liver, and controls a whole bunch of areas. It's a big nerve for your rest and your digest system. So you have your fight or flight system and then your rest and your digest system. So you want that to be working very well. Now, they found that 3 hours after a concussion or a head injury, this nerve stops firing as much. And now you can actually start to see the intestinal lining start to wear away a little bit. And that causes some issues with food slipping through there, and now your body thinks that's an enemy and it starts attacking that stuff. And so this is possibly where food sensitivities can come from. It can cause autoimmune conditions down the road, so your body attacking itself. Some things like MS and Parkinson's and ALS, Alzheimer's, all that stuff can actually possibly be linked to some of these things. And then heart rate control is also thrown off too a few hours after a head injury. blood flow in the brain is literally different after a concussion, and it could be because of this nerve here. So you can start to do some things that can actually stimulate that nerve a bit more. We use some different therapies in the office too, but they're pretty basic stuff that you can actually start to do yourself. So the first one's called the oculocardiac reflex. If you've ever seen anyone who's really stressed, they're kind of, they have their eyes closed, they're kind of rubbing their eyes like this, and they're literally subconsciously trying to lower their stress by decreasing the pulse and the blood pressure. So that sends direct signals to the vagus nerve to do all that. So you close your eyes, there's gentle pressure on the eyes for about 10 seconds. So the Herring-Brewer reflex, the second one there, these are basically stretch nerves in your lungs. You take a really deep breath in, and you fire off those nerves, and it goes right to that vagus nerve, and it subconsciously will lower the pulse and the blood pressure. And so this is where a lot of breathing techniques can come in, and meditation and all that. You're actually activating this reflex here quite a bit, and those stretch receptors in the lungs. Last one is the baroreceptor reflex, and that's if you kind of rub right on the right side, right where the traps enter the neck there. You have basically a pressure sensor that you can put some gentle pressure on there, and you rub for about 10 seconds. And that's actually right near the vagus nerve where it travels down as well. So you can actually lower the blood pressure and heart rate and stimulate that nerve just by doing that. We put a pulse meter on someone's finger at the office, and you can actually start to do some of these reflexes, and you can see the heart rate just start to drop about 5 beats or so. It's pretty neat. So you can actually see it's almost instant that it can happen. Alright, so this is kind of an interesting picture here. This is a normal scan. You can see it's kind of like a nice tree forest. And I believe this was 15 years down the road on the head trauma side, and there's big chunks missing and gaps. This is untreated concussion, and so very important. I'm going to have a few images following here as well, kind of going over some of this stuff. Has anyone heard of the term CTE? All right, and this actually got a lot of press in the movie Concussion with Will Smith. All right, so you can see once again, we're kind of beating a dead horse here, but healthy brain, look at the size of it there, look at the connections, it's all nice and fluffy. And then this is actually Alzheimer's on here, but a lot of these conditions look semi-similar, and it almost looks like Swiss cheese in a few spots there. Yeah?
How easy is it to get imaging of the brain? Like, so you can actually tell, like, to set a baseline as to where somebody's at?
Right, so it's not, well, especially in our healthcare system, you almost have to be dying to get an MRI or CT scan usually. So it's not too easy. The US is getting better with this, and they're actually starting to come out with a few different tests that are going to be more mobile. And there was actually a blood test, I believe it was last February, that the FDA was looking to approve. So you can get a better result that way. The States has more functional MRIs as well that can help with a lot of this too, looking where blood flow is going and all that. So it's not too easy though.
Okay.
Yeah. Yeah.
I got an MRI in 5 days
Okay.
because I paid for it.
Yeah.
There you go.
$700 and some dollars.
$770 if you want to pay for it.
Sometimes you get pretty fluffy, you gotta pay.
Yeah, exactly. Yeah, you can have it within a week. You got to pay for it.
Under that condition, $800. Sorry, $800 might be cheap. You might say, you know, if you have the money, it might be
But
cheap.
once again, you can't see a lot of this stuff on MRI, so I don't know if it would be worth money.
Yeah, well, it might not show it.
Yeah, I think the stat was like 90% of MRIs are normal. So in certain situations I recommend MRI, but not for concussion specifically, because usually it's not going to show much.
More the PET scan and that type of
Yeah.
thing, okay? And I don't even think those are available here.
Yeah, exactly. Yeah. Yes. So found another Canadian stat here, and they found actually the risk of suicide actually increases 3 times after a head injury, and suicide or suicidal tendencies, that's actually a change in the frontal lobe. And so we were talking about a bunch of changes with the frontal lobe before, so you can see how things are kind of linked up in the brain there. Alright, so this is basically how concussion can look right after the fact, and it can be one of these things, it can be all of these things, it can be a couple of these things. That's what makes concussion so difficult to really recognize. I had one patient that he answered all the orientation questions, he knew his name, his parents were telling me, and everything was fine. They walked out to the parking lot after the hockey game, and he couldn't actually remember how to open up the car door.
Yeah.
He was just sitting there looking at the car, and so that was a little scary. It can be very hidden sometimes. And then even a few days, few weeks down the road and years down the road, it can turn into a lot of these things here. Once again, it can be one of these. It can be all of these things. It can be just a mix. That's what makes concussion so difficult. It can just show up as a little bit of maybe off balance, and that's it. Or just every now and then some dizziness. So it can be pretty subtle. All right, so basically if you see a car accident in front of you, you saw someone get creamed at a hockey game or something, and you're there, obviously take first aid protocols and make sure you don't move them if you're suspecting any spinal cord injuries or anything, but then you have them rest for 15 minutes and then you can start to ask them some questions. You don't just start blabbering away and what's your name and all that right away. The adrenaline response is still going after the injury, and so you have to let them rest. And then you don't ask them simple questions. Your name is stored in many different spots in your brain, in long-term storage. So ask certain things like who was the first person that came up to the scene, or what play were you running, what's the score in the game, what'd you have for breakfast this morning, just something that requires the person to think about and answer accordingly. And then you basically want to monitor how they're doing, but people need to rest as much as possible. We used to think that you need to wake them up as much as you can, and obviously, like I said, monitor them, make sure they're breathing and all that, but the brain has been through a lot. It just went for a crazy sprint, and it needs to recharge and sleep as much as possible. And now what they're finding was back even 5 years ago, we were thinking that you had to sit in a dark room for weeks and just rest that way. But you need to rest for a couple days of sensory deprivation there, so no bright lights, loud sounds. And then you start to slowly get back to what you were doing just a little bit. And so starting to add in a tiny bit of exercise and a bit of some reading and concentration. So you don't just hold off for weeks. So the people that get back to a little bit of their normal routine faster did way better than someone just rested for a couple weeks. Does that make sense? Wait.
Excuse me, I just have a little comment. I think
Yeah.
that what you were just mentioning, it's really generalized concept,
Yep,
because it can be really, really
for sure.
different way.
Exactly. But it's,
And that 2 days or 3 days or whatever, or a week after getting out of the dark,
yeah,
sometimes it's not even an option.
yep.
Not an option.
For sure.
Months.
I'm with you with that. And that is fairly general, but I still wouldn't do more than a week or so. I would just do some really basic stuff, like you're going to walk for 30 seconds. If all you can do that day, that's fine. Then you go for 45 seconds the next day. You got to meet your body where it's at, and you have to try to make this stronger. I hear you. But you have to try to do something to try to... Basically, nerves are set up in a way that if you don't use them, you start to lose them. And if it's just the most basic amount of activity, that helps it heal faster.
That's what I say here too, just get up and make a cup of tea, start with that, and see how well you can sequence everything. And if that still exhausts you, you need some more rest.
Yep.
And then just slowly build on it.
Yeah, for sure. There's some people that are so compromised, we need to just have them lay down on the table and we're just moving their arms and legs for them. And we're doing passive motion rather than them actually actively moving things. It's a different consequence in the brain, so yes.
So would the accumulation of, let's say, 7 concussions, that would make a difference in your comment, wouldn't it?
Definitely, yeah. Exactly.
Thank you.
I have
That's what I wanted to hear.
I have a retired NHL player that's had 14 concussions that he knows about. He told me there were certain times he got a concussion, he couldn't even read the scoreboard, the Jumbotron, and he still kept playing. And so that's definitely different. That's almost like scar tissue that you're working through in the brain, like spraining your ankle 14 times. Yes, that's a little bit of a different situation.
And what happens if the person doesn't rest? They just push, push, push. And you're like, I don't think I have a concussion. I should be
So
fine.
things last a lot longer for recovery. They can add another month or two, depending on what's going on as well, from what I've seen. Okay, so I don't have a ton of time to go over the nutritional stuff, but just in general, stay away from fast food, salty food, junk food, sugary stuff. Usually carbohydrates, a ton of those can actually flare up some symptoms. I have ketogenic listed at the bottom here, and that's been shown in the research to help heal things quicker as well. So that's more healthy fats and lower carbs in the diet.
Can I put my hand up?
Sure.
Can you please think about taking that off?
Why is that?
Because
I'm on the 7 to 10 concussion thing. I had a practitioner say, oh, you need to do the ketogenic diet. You might as well have hit me over the head with a hammer. I was almost acting stroked because my body needs the glucose, my brain needed the glucose.
Yes.
And so I'm not eating that other stuff, but fruits, vegetables every 2 to 3 hours. And when I tried keto, because of the okay, I'm losing my words. The keto threw my immune system completely out of whack because of what the damage of the concussions have done in my brain.
For sure.
And I was working with a chiropractor who I think does some of the stuff you do. We were getting so far ahead, and then when I did that ketogenic, I went so far backwards. I am 2 years post-concussion on the last one, and I'm probably at a 3-month mark.
Yep.
And the ketogenic is the biggest piece that went in that I wish I would have never, ever, ever done. And I can't be the only brain that's going to react that way after a concussion with
Definitely.
it.
So all this stuff, this is what, once again, makes concussions so difficult.
A normal brain, if you want to play around, because it's a hard process to switch from a glucose, using glucose as a fuel to using fat as a fuel. We know that's a stress on the body.
Yes.
So when your brain is already stressed with a concussion, I just don't know if you need that much more stress on your brain.
Exactly.
Okay.
So.
And I have a 20-year EMS background.
Perfect. Awesome. That's
so
good.
I'm not just talking.
I worked as an EMT for a couple of years, so yes, I know where you're coming from.
As well too. We do have a video up there, consequences of multiple concussions. You both would be very beneficial to watch that video.
Yeah.
It's up on YouTube and Facebook page for us.
And I know my story isn't everyone's story, but
sure.
I would hate someone else to go home and end up going backwards.
Exactly.
Of that, right?
And everything I'm talking about here is you're going to have different experiences with your particular situation. This is all just based off the research, but what they've been finding. It can work for some people. Obviously, it's not the gold standard. This is what makes concussion so difficult is exactly. I've had patients that this was the one thing that got them out of their room and starting to be a human being again. In your situation, it wasn't for you.
No.
With anything dietary, just know that there's different diets for every person out there as well. Exactly. I actually can't do the ketogenic diet. I lose too much weight. So I lost 15 pounds in 10 days. So I can't do the ketogenic diet. There's different diets for every person out there. So it's not just take that with a grain of salt. I just want to let you know what the research is showing. And in your situation, I wouldn't do that as well. But just want to throw out the research out there.
I liked the food, don't get me wrong.
Yeah, exactly.
My brain and body did not like that.
Well, this is also one diet that is tough because not everyone who does ketogenic diet truly gets into ketosis. So they don't actually switch. They think they're doing it, but it's more of like they call it a dirty keto diet. And they're not actually getting into ketosis.
I switched really quickly.
Okay.
And probably too quickly for my brain.
Okay.
Maybe. I don't know. I
Okay.
don't know about on that, but yeah.
All right. Okay, and then right after a concussion, just stay away from really intense environments, concerts, movie theaters, flames games, stuff like that. What's that?
Grandchildren.
There you go. That's one of them.
Oh, yeah.
I highly recommend no alcohol.
Yes.
Oh, yeah.
That's for sure. That's going to alter blood sugar levels and all that too. Alrighty, so like I said, I'm not going to cover nutrition too much, but there's a lot of even great supplements out there that can help give the brain building blocks that it needs to help heal things too. Alright, and if you are really struggling with this stuff, once again, the Dr. Locator, thank you for bringing that up. You can find someone that's more trained in functional neurological disorders, and this is literally what we do all day. We analyze people's function neurologically, and so we're very well suited for concussions, which are more of a functional issue. And there's a huge scale between medically normal and medically abnormal, and that's where a lot of people fall into, and so they're kind of lost in the cracks in our medical system, so we can do better than that. Okay, so if someone comes into our office, we're going to do a thorough history. We're going to sit down with them, ask a bunch of questions, go over their injury history, and then we're going to do our examination. And we're basically going to go over their balance. We're going to look at all the cranial nerves, the eyes quite a bit. We're going to look at sensation, reflexes, strength, all that stuff. And then we do have one piece of equipment called a VNG, and it stands for video nystagmography. I'll show you here. And these are some infrared cameras that we can put over the eyes. We put the eyes in darkness, and we can kind of see what's happening at a better level compared to just looking at someone. And so a lot of subtleties do come out. You can see what's happening with the pupils, how they're actually starting to react now when we introduce light, as well as what's happening with the eyelids, how the eyes are moving when we're moving the head around, and stuff like that. So it's our success rates went up quite a bit when we got this piece of equipment, and I feel like it's very important. So this is just someone that was a 21-year-old kid that came in. I had to keep telling him to open his eyes. They kept closing with all the testing that we were doing. And anytime you see a decrease in brain function, the eyes just start to get lazy, and they almost just start to close a little bit. And then this was 3 months down the road. We threw the goggles on, and the eyes were just open. You can see he's firing on all cylinders there. It was really neat to see. I had to photograph it and put it in here too. So once again, the eyes are very important. Okay, and everyone asks, okay, so what would you do for this concussion? What would you do for that concussion? And once again, no two concussions are the same. You can't do the same treatment with each person. So you have to do your thorough exam and see what's working great, what's not working so great, and then do your treatments there. So we would be doing some different eye therapies for that person, balance, coordination, work with heart rate control quite a bit with the autonomic side of things, and then chiropractic adjustments as well. And this is why I got into this stuff, actually. The neurology is, I saw how the adjustments were actually impacting the brain. So you can put someone's feet together, you can have them close their eyes, and maybe they're swaying a little bit to the side like this, and you can adjust them, and then you can measure the balance after, and they're actually straight up and down. And it's pretty neat to see. And so adjusting the spine actually has a huge impact on the brain. I'll go over this in just a second. So one thing you can take home tonight is your nerves to be totally healthy, to be perfectly healthy. You need these 3 things. That's it. And this is where a lot of rehab should be focused, is on oxygen, on good food, so nutrition, and stimulation. And this goes to your question here of resting and how much stimulation is too much. You need to have the adequate amount of stimulation. You can't have too little, you can't have too much. And this is where the art of treatment comes into play here. You have to be monitoring what people can handle. If you overdo it, you can send someone back years, like your example. Okay, and so it was actually a medical doctor that found this. He won a Nobel Prize, that 90% of the information going up to the brain comes from the muscles and joints in your spine. So it wasn't a chiropractor that figured that out, it was a medical doctor. And so when you cause joint motion, you cause joint and muscle activation, that causes brain activation. And so you can see some changes just by altering the function of the spine. So you can't discount that fact as well. Anytime I see any arthritis in anyone's back, guaranteed there's probably something going on with the eyes or their balance. All right, and just a few little tips here to prevent some concussions. Some of it's fairly self-explanatory, but seat belts, that's a biggie. Just make sure that the seats, seat height and levels adjusted properly too, so it's not too close to the steering wheel for airbags, the head's not too far away from the headrest and all that. This is a biggie here, is items secured in the car, or put them in the trunk. I've had, actually one of my most complicated concussion cases is a girl that was sitting in the front seat. They rear-ended someone in the car, and they had a hockey stick in the back seat. It flew forward and hit her in the back of the head. And it can do a lot of damage. It's basically like a missile in when you're going pretty quick. One other thing is, one guy had a metal toolbox that was sitting right beside him. Exactly, yeah, and he got T-boned, and it actually flew into the side of his head, and got quite a big dent in his head from that one. Okay, and pretty self-explanatory as well, but protective equipment when you're active. Make sure it's the right helmet for the right sport. It's adjusted properly. It's the right size, and it's actually in good condition as well.
Can I ask a question about this? Like, I get these things, but I feel like if you're like a Canadian that is leaving your house and going anywhere in winter, and you don't necessarily want to leave the house wearing a sumo suit, what do you do?
Just mean to minimize your chance of getting a concussion?
Yeah, because I feel like there's so many things where you can slip, or there's like all these stupid
exactly.
things you do.
Yeah, it's.
You're like, okay, don't play stupid.
I hear you. You have to live your life, for sure. Yeah, it's just being smart about it as well. Like, just being present of what you're doing. I've seen actually a lot of head injuries with people's trunks slamming them on the head, or the trunk coming out and hitting them in the head. And so one person left their car in neutral and it rolled back and it hit them in the head. And just there's a lot of stuff that can happen out there. I can't really account for every situation, but I hear what you're saying.
Dr. Haxton?
Yeah.
I have a lot of background in falls prevention, and what I found is where a lot of the falls happen is when people are in a hurry.
There you go. Yeah.
Right? It's like they're pretty conscious of their environment, and it's the one time that they ran out and didn't check the ice,
Yeah.
or running to the car, whatever.
There you go. That makes sense. So slow it down.
Or they're looking down
Yep.
instead of ahead. Don't walk with your hands in your pockets.
Yes.
Because if you take a slip, at least you've got your hands out to balance.
For sure. And even, I see this a ton, working on your stability and your balance just a little bit can actually prevent a lot of that stuff too. So it can be as simple as, if you're usually standing with your feet far apart like this, just starting to move them closer together, just a very basic activity. If you're just sitting there, say you're preparing something in the kitchen, just start to stand on one leg every now and then for a few seconds. Go to the other leg. You can do a lot of stuff easily to try to challenge yourself just a bit to help prevent some of that too. Okay, so a lot of offices are starting to do this now, and it's baseline testing. It's where someone comes in, they feel great. We record their eye movements, their balance, we put the goggles on. It's about a 15-minute appointment, and we record all that stuff. And if something ever happens, car accident or sports or whatever, they can come back and we can compare their baseline assessment to how they're doing at that point. And with concussions and any head injury, it's tough when people come in, we do our evaluation, we don't really know with 100% certainty what we're seeing is truly from the concussion. It could have been happening a few years before and just made it worse. So with this type of thing, it does help our management a bit. We can say, yes, this is different compared to how you are now. So that's why a lot of people are doing baseline testing now too.
I see where I'm from out in Cochrane, and in our sports facility, they were offering baseline testing for a lot of the hockey teams.
Yeah.
Kids in hockey teams.
Right. I chatted with them, and that's great, and I want that to be more widespread. And there's lots of different tools that people are using for that, and a lot of arguing back and forth what's the best test to use for this and that. Just to have something recorded is always a good thing too. Okay, so hopefully you're still with me at this point. Any questions?
Do you, in your treatment plan,
Yeah.
because I just connected, do you know a Dr. David Clark? I believe he's one, okay, you know
In
who
the
I'm
States?
speaking of?
Yeah,
Yes.
yeah.
So I just, he just phoned me the other day, so I think I'm gonna go down and see him unless you guys do this. I
Okay.
have to leave here. Do you guys address the metabolic malfunction as well?
So that's where I was going to say he is the guru for everything functional medicine. So
And he phoned me.
yeah,
Okay, I knew I was really excited
Yeah.
that he actually phoned me. I can't get my own
Yeah.
fucking doctor to phone me.
I know.
But he phoned me.
Yeah.
Sorry, I swear.
No.
But you know, I can't get my general doctor to return my phone calls.
Exactly.
And he phoned me. I just sent him a letter and he said,
Yeah.
what's your number? And he
that's
phoned
neat.
me.
No, he runs a lot
Okay,
of
so-
the neurochemistry modules. He's great. He knows his stuff. I don't
Okay.
focus on that specifically. I would say that would be a good option for you based off what I've been hearing. But
Oh, thank
Yeah.
you. Thank
Okay.
you.
Where
I
is
really
he?
appreciate
Where in the
that. North
States?
Carolina. Oh, go ahead.
actually, no, go for it. It's fine.
North Carolina. North Carolina. Yeah.
Errol, you had a question?
Yeah, are you seeing more concussions, head injuries due to cell phone use? Inattention?
Yes. You know what? A lot of people aren't even admitting to that, but I suspect it a lot of the times for sure.
Now look at where they're going.
Yeah. Yeah. There was
It would be.
I've seen a lot of it where kids come in with their parents, like teenagers, and he said, I don't know what happened. The pole just came out of nowhere, and I'm thinking, okay, you were probably distracted. So I've seen a lot of that for sure. Yeah.
What would you recommend if someone came in and they did very well on your baseline test and through a lot of your testings, but they were still having symptoms every day after 2 years?
Yeah.
Like what would do you see that a lot, and what would your treatment plan kind of look like?
It's interesting, actually, you mentioned that. I've seen with a lot of baseline testing, there's things that people are coming in for that they didn't even know were happening, and I would actually start treating them even though they came in feeling great. So I feel like symptoms are very unreliable. So I don't see that too often where someone is perfect with our baseline test. Either their balance is off. I catch a lot of things with certain, they're called primitive reflexes with kids, and so I catch those, and I kind of chatting with the parents about that. So I don't really see that too often where everyone's perfect. And then it's kind of the world we live in with a lot of stress and all the chemicals in our environment and all that. Not everyone is perfect with everything.
And we're in Alberta, like I don't know about in the city, but I'm rural.
Yeah.
I believe most people are walking around with some degree of head traumas, because look at how much rodeo we have, look at how much sports we have,
Yeah.
bicycle riding, motorcycle riding, like you said, car accidents, falls. How many of us have fallen and banged
Sure.
our head? And we just keep going, and then you do that 6, 7, 12 times, right?
Exactly, yeah.
And those people are just walking around, not even diagnosed, a lot of them,
Yeah.
right? And thinking that these are other problems.
Yep. That's exactly it. You had a question back there?
So
Yeah.
does your treatment plan or approach to a concussion differ from whether it's, happened last week or if it happened 2 years ago? Like, is it a big difference?
Yeah. So basically the big thing we gauge right off the bat when we start treatment is how much can the person handle, and we test the endurance. And we do a lot of things laying down first and then go to sitting and standing, and that's different for each person. So I've seen it go both ways, where an old injury actually responded quicker than a new injury. You can't really base it off of the timeline, unfortunately, too. But I just have to gauge, it's called metabolic capacity, and just have to figure out how much they can handle in any treatment that you're doing. Yep. Yes?
So what would a typical, like I know you were saying stuff isn't necessarily typical, what would a typical treatment plan and sort of initial assessment look like, and what sort of fees would typically be associated with?
Yeah, so first exam or first appointment is about an hour long. We charge $249, which is actually cheaper than a lot of places right now. It might sound high, and then basically we do our report the next visit, and that's about a half hour long, and then each treatment session after that is about 15 minutes, and I send people home with a lot of homework. A lot of my colleagues that are doing this in states and things like that, even at the Carrick Institute, they'll have someone for about 8 hours, 10 hours for a week or two straight. And I'm not really set up that way. I have people come in, we assess how everything is, we do our treatment, send them home with a bit of homework as well. And it's been working pretty well with that style there too.
So then would it be like billed out per treatment session afterwards?
Yeah, exactly. Yeah, usually do our progress exams after a month or so. We redo all those same tests we did when they first came in, put the goggles back on, and then fine-tune our treatments at that point.
And how long, like, would someone
Yeah, it's all over the place. It can be 3 or 4 weeks. It can be 6 months, a year, 2 years. Everyone's different. I was just thinking about this on the way over. There's no pattern to it, actually, how people are going to respond as well.
And would you change the course of treatment if you were doing something and the person just wasn't responding?
For sure, yeah. Definition of insanity is doing the same thing, expecting different results. So yeah, definitely.
It's called FN, sorry, is that what it is?
Yeah, functional neurology. Yeah, there's kind of interchangeable. We're with the
Chiropractic neurology. I've even seen chiropractic functional neurology.
Exactly. Yeah. Usually I just say I'm a specialist in the chiropractic field. I try not to get into it too much. People get a little confused, so yeah.
So what treatments, because I was just reading, which I didn't even realize I'd signed up to this because, concussion brain. So I must have saw this, signed up, and so I must have been reading about the Carrick Institute. Then, I got introduced about Dr. Clark,
Yep.
and then I was rereading and I'm like, oh my goodness, so can you tell us a little bit what the Carrick Institute does?
Sure. So they started,
right?
the Carrick Institute started functional neurology, and they basically, on the same track, they figured out what the adjustments were doing to the brain, and they, back in the day, 30 years ago, they actually did research papers on adjusting someone's left arm actually changed brain function on the right side. It changed the blind spot size and things like that. They've done a lot of amazing things for advancing the field of neurology even. They've lectured at Harvard Medical School, and they're on the cutting edge where our medical systems always, they kind of lay back on their haunches and wait for something to be 1000% certified and approved through the FDA and all that as well before they even start to implement any treatment strategies. So the Carrick Institute is pretty well versed in the current research, and they're throwing these treatments right away to the public, and they're getting great results. Sidney Crosby, a lot of professional athletes they're working with as well. So It's pretty cool stuff. From what I've found, and so we're actually getting a lot of referrals from NUCA doctors because they're not getting the results that they want, and so you basically need to start a little bit slower with someone with some different treatments before they can handle that NUCA adjustment as well. Yep. Yes?
If someone wasn't open to having their neck specifically adjusted,
Yep.
would you still find other ways to?
For sure, yeah. I never force anyone to perform any treatment. We have a lot of different tools and techniques to get the job done. A lot of people can't handle a full manual adjustment anyways. They're so compromised that that'll set off a lot of symptoms too. So we start with other techniques. Yeah.
We're good?
Okay.
Yeah. Well, thank you very much
Thanks,
for
guys.
coming to talk to us. I'd like to present to you a copy of my book.
Thank you.
And give you a little bit more idea of the hardcore cases.
Perfect. Thank you so much. All right.
Probably the people you never want to see.
Well, those are sometimes more interesting, but thank
And
you.
actually, I'm very proud of that work. I had my family doctor at the time. He's a professor in family medicine. He said it was actually better than a PhD thesis.
Cool.
Yeah.
Okay.
So a lot of people do say it's a textbook on brain injury.
Okay. Well, thank you. I'm always looking for new stuff.
Yeah,
Thank you.
thank you very much
All
for
right.
coming. We appreciate having you.
You're welcome. Thanks, guys.
Thank you.